Welcome to 𝗖𝗵𝗻𝗺. This topic for today is belonging to respiratory system, and the topic of discussion is zygomycosis, aspergillus, pneumocystis. These three are the important fungus associated with the respiratory system. Yes, of course, Paragonimus is another important microbe, or you should say Paragonimus is another important parasite which is important for what? Important for the respiratory system. But since we have already discussed about Paragonimus, I will share the link of the video in description. But please, my dears, if you are preparing for respiratory system, do revise that. Okay. So coming on to opportunistic infection. So one is the Aspergillus. Okay, I have told you one is the Aspergillus. Other opportunistic are Zygomycosis and Pneumocystis. Coming to Aspergillus. Aspergillus is a septate hyaline hyphae. So this is the hyphae I am trying to make for Aspergillus. So it is a septate hyphae and also called as hyaline hyphae, and it is dichotomously branched. Now dichotomously branched means it is going to show branching at acute angle approximately at 45 degrees. Okay, so can you see with the vertical it is going to make an angle of 45 degrees. So these are the acutely branching septate hyphae, acutely branching septate hyphae which are there for Aspergillus. So A for Aspergillus, A for acutely branching septate hyphae which is going to be there. Okay. Now Aspergillus is of three types: Aspergillus fumigatus, Aspergillus flavus, Aspergillus niger. So Aspergillus niger, as the name suggests, is responsible for making the black colored colonies. Aspergillus flavus and fumigatus. So fumigation, do you know fumigation? What is fumigation? Yes, fumigation. So fumigation is done, the spray is getting fumigated on the green leaves of the plant. So fumigatus, just the mnemonic is green leaves, so it shows a green colored colony, whereas flavus is something that is going to show yellow colored colonies, right? Okay. So this is important. I am going to make a very important structure for you now. See the structure. Okay. So if you see, there is only one layer. If you see, only one layer is there, and the meaning is, okay, let me just label the parts for you. This is called as conidiophore. This is called as conidiophore. So as I was discussing, that fumigatus is having the green colored colonies, flavus is having the yellow colored colonies, niger is having the black colored colonies. So if you see the two diagrammatic representations which I have tried to show you, see here you have got conidia. So this is the conidia which is there, and these are the only one layer, okay, so of the phylads. Okay, these are called as phylads. So basically if you see, you have got the first of all the conidiophore, then the layer of phylad, and after that you have got small that is called as conidia. Okay. So here if you see in this first picture, you have got only one layer of phylads. This is called as unicerate. Now this unicerate one is the Aspergillus fumigatus. The unicerate one is Aspergillus fumigatus, whereas my dear friends, the other one where you can see bicerate phylads, okay, this either belongs to flavus or belongs to niger. So if it is black color, it is going to be which one? It is going to be the niger. Now one more important difference is, can you see, these conidia are present only on the topmost 2/3 and not entirely, whereas these conidia here are present everywhere. So remember, flavus is having full on, flavus is having full on. So I am writing it, flavus and niger, they have full on conidia. That means conidia is present on all the surface, number one. Number two, that's very important, is that these are biserrate. These are what? These are biserrate. Whereas if you talk for fumigatus, please remember that fumigatus is having only on 2/3, upper 2/3 it is having, and yes, it is a uniserrate because it has got only one layer of phyllad which is there. Okay. So, if you can see, I will make you watch a, not this, yeah, see here. First of all, it is a dichotomously branched at an angle of 45 degrees, a dichotomously branched, so it is Aspergillus, okay, and because it is forming the which colonies? The green colonies, this is the fumigatus, okay, and can you see fumigatus is having the conidia where first of all it is a uniserrate one, only one layer is there, so it is a uniserrate one, okay, and that's to see, can you see there is nothing here, there is nothing here. So, that means it is not full. So, this is what? This is fumigatus. After this, so we have discussed Aspergillus. Now, in clinical features of Aspergillus, please remember that the clinical features are very important in both of them. It is not conidia, it is candida. The candida and the Aspergillus, just both of them are responsible for causing decrease in WBCs, that is neutropenia. These are responsible for causing leukemia although, right, the leukocyte count is increased but neutrophil count is decreased. They are angio-invasive, they can invade into the blood vessel, and yes, this invasion is very much serious, such that if after this invasion it enters the bronchopulmonary segment, it causes a bronchopulmonary aspergilloma, that is a fungal ball which is there. This fungal ball contains lot of Aspergillus. Why? Because it is angio-invasive, okay, angio-invasive. So, this aspergillosis leads to hemoptysis because it is angio-invasive, so there will be blood, then that blood is going to come out with the cough. It leads to pneumonia because any infection, if it is going to lung, it is pneumonia, and yes, it may produce cavities. So, once the fungal ball is removed, okay, the fungal ball is removed, this is going to form a cavity over there, right. So, as I have told you, Aspergilloma fungal ball, yeah, it is most commonly formed when there is a pre-existing tubercular cavity. See, TB is potent to cause anything in the lungs. So, they can cause pleural effusion, they can cause pneumonia, they can cause cavity, they can cause fibrosis, they can cause collapse. So, if there is a cavity which is prepared, fungal ball can easily start to grow there, okay. Now, other things, it is responsible for causing ear infection called as otomycosis, responsible for causing eye infection, keratin, so keratomycosis is also formed. So, if you can see, the way to remember, it is very simple, you have to keep in mind the blood vessel. So, blood vessel, first of all, it is going to decrease neutrophils but increase WBCs, that is leukemia. Second, it is angio-invasive, so it can go and to the bronchopulmonary aspergillosis or aspergilloma. After that, two things which we have to understand, one is the eye and other is the ear. Both of the subjects were there in the third year, now shifted to final year, and I don't know what is happening currently, but yeah, so easy to remember. So, the treatment, yes, it is very simple, A and V look similar, okay. So, mirror images. So, mildly V, that is voriconazole, severely A, that is amphotericin B, is the drug of choice that you give for the aspergillosis. Coming on to zygomycetes. Zygomycetes is also an opportunistic fungal infection. If you are confused regarding the classification, you can watch our general mycology video, and then you will be, especially the 6th video, both the parts, part 1 and part 2, then it is going to be very clear to you. So, my dear friends, please remember that zygomycetes are also called as mucorales, Now, zygomycetes are aseptate hyphae. These are vertical ones. They are having right angle branches. So, if I just make like this, and this is what is called as zygomycetes. So, zygomycetes is aseptate. It is having 90 branches, vertical, and yes, aseptate hyphae. Although I am personally against ragging, but it used to be a culture, give a 90 salute or something like that. So, anyways, So these are the Zygomycetes, okay. So 90-degree branching, okay. So if I talk for the genera differentiation, remember in Zygomycetes there are 3 genera. One is 𝗵𝗄𝗄, then Rhizopus and Mucor, okay. So 𝗵𝗄𝗄, Rhizopus and Mucor, there are 3 in Zygomycetes. So one is going to have the internodal rhizoids. So for example, if I just want to make 𝗵𝗄𝗄 for you, so see here, these are the one, this is one node, this is the second node, and here if you are having the branches, this is called as internodal rhizoids, okay. And so this is for 𝗵𝗄𝗄. So if you want to make rhizop, so Rhizopus is having the nodal one. So Rhizopus is having what? It is having the nodal one, okay. So this is the Rhizopus, whereas Mucor has no rhizoids. So what are rhizoids? Rhizoids are the rootlets actually. Rhizoids are the rootlets, okay. Mucor has nothing, okay. Now what are the predisposing factors? Anything that is decreasing the immunity, just like diabetes, uncontrolled, or diabetic ketoacidosis, dialysis patient, and the patient on desferoxamine therapy, iron chelation therapy. This is important, so please don't forget. And yes, of course, COVID-19, do you remember? COVID-19 has a lot of, because what people were doing for the treatment of COVID-19, they were giving steroids. So steroids were decreasing the immunity, and this fungus in particular is very notorious opportunistic infection. So it was growing, right? So these are the important ones. Now how to diagnose, how to stain this? This was being stained in 𝗏𝗃 white stain, right? So there was a broad aseptate hyphae, right? So how? With the help of sinus aspirate, this was the specimen which we used to take. Sinus specimen is something which we take, and then it is stained in the 𝗏𝗃 white stain for the Zygomycetes. 𝗏𝗃 white stain for the Zygomycetes. So how to remember? If you remember Mucor, yeah, black, everything black. See here. So can you see Mucormycetes? Everything black fungus. So in order to stain that, put white stain. So 𝗏𝗃 white stain you have to put. 𝗏𝗃 white stain you have to put. And I think I have got a picture also. Yeah, can you see? This is Mucor. There are no rhizoids. There are no septae, there are no septae, and the branching is also at 90 degrees, okay. More or less it is the 90-degree branching which is there, non-uniform diameter, and actually the branching which is there at 90-degree Mucor species, okay. Yeah. So after that, yes, this is also angio-invasive, that is why Mucormycosis was happening, and the most fatal one is the rhinocerebral Mucormycosis. The one which is traveling from the nose to the brain is the rhinocerebral Mucormycosis. So what it causes? Okay, I will make a diagram to tell you. First of all, in the frontal lobe, it is responsible for causing frontal headache. Next, coming to eyes, it is responsible for causing orbital edema. Then near the nose and near the nose, it is responsible for causing the blackish discoloration, blackish crusting near the nose, and yes, all of this is painful, and ultimately there will be ischemia. That means why actually? So please understand, there is angioinvasion which is happening. So because there is angioinvasion, that means the blood vessel is destroyed. So there will be decreased oxygen that leads to, in order to repair this invasion, there will be thrombosis, more oxygen decrease, that leads to necrosis. So there will be necrosis which happens in the sinuses, the black pigmentation which you see. Yes, indeed it is painful. So what is the treatment of choice? The treatment of choice is amphotericin B, which you have to give, okay. So very simple to remember, Zygomycetes starting with the letter Z. So the treatment is starting with the letter A, that is the amphotericin B, because in the alphabets A and Z come very close to each other. So coming on to Pneumocystis zygomycosis, very important. Pneumocystis zygomycosis. Please understand, Pneumocystis zygomycosis is a pneumonia, is a fungal pneumonia which is seen in HIV positive patients. Pneumocystis zygomycosis when the CD4 count is less than 100, when the partial pressure of oxygen is less than 80, and when there is a lot of lactate dehydrogenase which is being present there, which is being formed there. So what happens, let me just tell you. So in HIV patients, okay, please relax yourself because this is little tricky topic. So I just want you to deep inhale and then listen to my lecture. So remember, in HIV positive patients, the CD4 count is anyways going to decrease, okay, and sometimes what happens is the oxygen amount is also decreasing, okay. So when the oxygen saturation decreases 80%, that means the respiratory epithelium is suffering a lot. That means respiratory epithelium is getting damaged. So the thing is that every epithelium and every cell has got a lot of LDH, right? So whenever they burst out, the LDH levels are going to increase, okay. So whenever CD4 count is decreased, that means the immunity is decreased. That is going to happen in HIV because acquired immunodeficiency syndrome. So immunity is decreased, the cells are going to get damaged, the oxygen is going to get damaged. Cell damage means there is increase in the LDH, okay. So remember, CD4 decreased, oxygen decrease, LDH increase, then the Pneumocystis zygomycosis is going to come, and once it comes, it is responsible for causing fungal pneumonia in HIV positive patients. So in nutshell, what we said just now is that CD4 count is going to decrease, partial pressure of oxygen is decreased, LDH is increased, then enters the fungal pneumonia, okay, by the help of Pneumocystis zygomycosis. Now my dear friends, please understand that how to diagnose Pneumocystis zygomycosis. In order to diagnose, you have to take a bronchoalveolar aspirate or bronchoalveolar lavage. So at the time you take either a bronchoalveolar lavage or sputum, you take out the sample, you stain it. How do you stain it? With the gamma-methenamine silver stain. Gamma-methenamine silver stain, GMS stain, and that is going to show you a broken ring, broken ball appearance, rather than broken ring ball, or rather than you should call it as broken ping ball appearance, okay, broken ping ball appearance. And because the name is Pneumocystis zygomycosis, so cystis word is important, there will be cyst detection in the microscopy, and remember the cysts are like this only, so these are the cysts. So this cyst is important. Why it is important? I mean, just to remember, I am telling you that this is just like a ping ball, Pneumocystis, ping ball, P for Pneumocystis, P for ping ball, and cyst is there, of course. And one important thing is cyst. So C and G look alike. So G for GMS stain, which you are going to use. Which stain? GMS stain. Of course, the other stains are going to be ELISA, the PCR, right? And the treatment, again, the treatment is with the C only. So C for cotrimazole. Cotrimazole is the drug of choice. So can you see? These are the cysts which you can see. Pneumocystis zygomycosis. This we have discussed. These all things we have discussed. Yes. So this is it for today's class. Thank you so much, guys, for watching. And yes, we are done with the respiratory system infections. Thank you.